Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1.
The nurse discovers that a 78-year-old client who received hydralazine 20 mg 45 minutes ago has a blood pressure of 70/40ths. The client has been on this dose of the medication for 3 years. Which of the following data is most likely significant in relation to the cause of the low blood pressure? Pedal pulses 11. 24-hour intake 1000 milliliters per day for past 2 days. Serum potassium 3.3. Pulse rate 150 beats per minute. The correct answer is 24-hour intake 1000 milliliters per day for past 2 days. Inadequate fluid volume when taking vasodilators can result in a drop in blood pressure when vasodilation starts to physiologically occur as an action of the drug. The nurse is assessing breath sounds in a bronchovesicular client. She should expect that inspiration is longer than expiration. Breath sounds are high-pitched. Breath sounds are slightly muffled. Inspiration and expiration are equal. The correct answer is inspiration and expiration are equal. Inspiration and expiration are equal normally in this area, and sounds are medium-pitched. A 30-year-old client has been admitted to the psychiatric service with the diagnosis of schizophrenia. He tells the nurse that when the woman he had been dating broke up with him, the CIA had replaced her with an identical twin. The client is experiencing grandiose delusions, paranoid delusions, auditory hallucinations, visual hallucinations. The correct answer is paranoid delusions. The client's thought content is fixed, false, persecutory, and suspicious in nature, which is characteristic of paranoid delusions. A 28-year-old client comes to the clinic for her first prenatal examination. In relating her obstetrical history, she tells the nurse that she has been pregnant twice before. She had a miscarriage with the first pregnancy after 6 weeks. With the second pregnancy, she delivered twin girls at 31 weeks gestation. One of the twins was stillborn and the other twin died at 4 days of age. Using a 5-digit system, the nurse records her as being 20210, 22212, 30110, 21100. The correct answer is 30110. The client is pregnant for the 3rd time, and the first digit reflects the total number of pregnancies. She has had no full-term deliveries, because she delivered prior to 37 gestational weeks, so the second digit is recorded as 0. The third digit represents the number of preterm deliveries, and a twin pregnancy counts as only one delivery. She lost an earlier pregnancy prior to 20 gestational weeks, and the 4th digit reflects spontaneous or elective abortions. Lastly, the 5th digit indicates the number of children currently living, and she has no living children. A 30-year-old female client is receiving antineoplastic chemotherapy. Which of the following symptoms should especially concern the nurse when caring for her? Respiratory rate of 16 breaths per minute. Pulse rate of 80 beats per minute. Complaints of muscle aches. A sore throat. The correct answer is a sore throat. A sore throat is an indication of a possible infection. A client receiving chemotherapy is at risk of neutropenia. An infection in the presence of neutropenia can result in a life-threatening situation. A 14-year-old teenager is demonstrating behavior indicative of an obsessive-compulsive disorder. She is obsessed with her appearance. She will not leave her room until her hair, clothes, and makeup are perfect. She always dresses immaculately. Recently, she expressed disgust over her appearance after she gained 5 pounds. After observing a marked weight loss over a 2-week period, her mother suspects that she is experiencing bulimia. She eats everything on her plate, then runs to the bathroom. In interviewing the teenager, she discusses in great detail all of the events leading to her bulimia, but not her feelings. What defense mechanism is she using? Dissociation, intellectualization, rationalization, displacement. The correct answer is intellectualization. Intellectualization is excessive use of reasoning, logic, or words usually without experiencing associated feelings. This is the defense mechanism that this client is using. A female client has married recently. A month ago she visited her physician with complaints of burning on urination. She was given a prescription for trimethoprim, sulfamethoxazole 2 times a day for 10 days. She was admitted through the emergency room on Saturday evening complaining of flank pain. Her temperature was 104 Fahrenheit. A preliminary urinalysis revealed 31 bacteria along with red and white blood cells in the urine. A preliminary diagnosis of pyelonephritis was made. During the nursing admission assessment, which statement by the client demonstrates a possible cause for pyelonephritis? I have not been drinking 6 to 8 glasses of water each day as the nurse had instructed. I'm afraid I may have something wrong with my bladder because I have been getting bladder infections frequently since I've been married. I took the Bactrim for 6 or 7 days. The burning stopped, so I saved the rest of the medication for the next time. I recently had the flu, which could be settling in my kidneys now. The correct answer is, I took the Bactrim for 6 or 7 days. The burning stopped, so I saved the rest of the medication for the next time. The most common cause of pyelonephritis is improper treatment of bladder infections. The client typically feels better after several days, discontinues the medication, and saves the remainder for the next occurrence of a bladder infection. For this reason, it is imperative to provide client education related to completion of the prescribed medication. The parents of a 2-year-old child are ready to begin toilet training activities with him. His parents feel he is ready to train because he is now 2 years old. What would the nurse identify as readiness in this child? Patience by the child when wearing soiled diapers. Communicating the urge to defecate or urinate. The child awakening wet from his naps. The age at which the child's siblings were trained. The correct answer is communicating the urge to defecate or urinate. A readiness indicator would be a waking dry from naps. A client is being discharged from the hospital tomorrow following a colon resection with a left colostomy. The nurse knows that the client understands the discharge teaching about care of her colostomy when she says, I know that I am not supposed to irrigate my colostomy. My stool will be soft like paste. My stoma should be red and slightly raised. The skin around my stoma may become irritated from the enzymes in my stool. The correct answer is, my stoma should be red and slightly raised. The healthy stoma should be red and slightly raised. If it begins to turn dark or blue, the client should see the physician immediately. Nursing care of the infant prior to surgical closure of a meningomyelocele would include: cover sac with dry sterile dressing. Cover sac with saline-soaked sterile dressing. Do not apply dressing, keep sac open to air. Aspirate any fluid from sac. The correct answer is cover sac with saline-soaked sterile dressing. A saline-soaked sterile dressing protects the sac from contamination by air and prevents drying.
Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.